For a typical general hospital like Doncaster and Bassetlaw services, we have about 25% of our bed stock as side rooms, and therefore it's absolutely vital that we use them to their maximum effect if we're going to be able to make sure that we manage the patient flows in a way that doesn't have to ad hoc and what are often disruptive ward closures. The proposal was brought forward from the microbiology and infection control teams to use the ELIA test to be able to screen patients at the point of contact to determine whether they were likely to have flu or not, which then allowed us to take decisions about the best place to put those patients in terms of infection control measures. Through normal virology services, that could be 2-3 days before a test result is back. With this test, we know almost instantaneously whether the patient is likely to have influenza, and obviously that allows us to make decisions about the best use of our side rooms.
The Allura I influenza A and B has been successful. It's helped us tremendously, especially in our medical admission unit, to be able to diagnose patients promptly, decide whether to admit them or discharge home.
The nursing staff on the ward areas where the earlier point-of-care testing is available have really embraced the fact that they can do this point-of-care testing to diagnose their patients and treat them in the most appropriate way.
I think it's a comparable test to the PCR for influenza. And this year we've not seen any disparity in the results we've seen so far.
I think it was a massive contribution to managing the normal disruptions of winter in terms of closed bays, closed wards, and obviously helping us to reduce sickness amongst our staff, in that if we knew that the patients had flu at the point of entry, then the staff were able to take full precautions with each patient as they came in.
I consider it a big success. Otherwise, most of our hospital units would have been paralyzed because of unnecessary bed closure, but we've been able to promptly isolate patients or cohort them, as the case may be. And we've also used it in our frailty assessment unit as well, because some patients come from either the nursing home through that pathway without going through our medical assessment unit. So it's been tremendously useful to the trust as a whole.
In introducing the test, we were hopeful that it would lead to the benefits that had been outlined to us, and in practice it appeared to do that in the early stages, and then as winter progressed it confirmed its worth to us as an organisation.
Just to let you know that your result was negative and that you haven't got flu.
Good.
Okay.